Welcome to Healthy Children. Today's topic is one that can be a bit vexing for parents and their preteen and teenage daughters, the HPV vaccine.
Genital human papillovirus, or HPV, is an infection that is sexually transmitted. It causes infection in the genital area of men and women.
Although most HPV infections don't cause any symptoms and go away on their own, HPV is still important as it can cause cervical cancer in women.
The vaccine is called Gardasil, and it's designed to protect against 4 strains of human papillomavirus, or HPV. These 4 strains together cause 70% of cervical cancers and 90% of genital warts. The vaccine is given in 3 doses over a 6-month period. HPV is the most common sexually transmitted infection in the United States and around the world. More than half of sexually active men and women will be infected with HPV at some time in their lives. 20 million people in the United States are currently infected, and 6 million more become infected every year. Most often, HPV goes away and doesn't cause any problem. But sometimes HPV infection persists and causes cervical cancer decades later. Every year, about 10,000 women in the United States are diagnosed with cervical cancer, and about 4,000 die from it. Cervical cancer is the second leading cause of death from cancer in women. The HPV vaccine is recommended for 11 to 12-year-old girls, as well as older girls and young women aged 26 and younger who haven't yet received it. It is licensed for girls as young as 9 years old. According to the FDA, the vaccine is safe and effective. It's been tested in over 11,000 girls and women around the world and was found to be 100% protective against persistent infection with any of the 4 severe strains of HPV that I mentioned earlier. There have been no serious side effects. The most common side effects are soreness, swelling, and redness at the injection site, and occasionally slight fever. Ideally, girls should get the vaccine before they need it. It works best in people who have never been exposed to HPV.
These are some of the key questions parents have about the HPV vaccine. You may have other questions or concerns, and you should never hesitate to ask your pediatrician directly.
For more tips on better understanding your children's health and well-being, and for all the answers to child-raising questions, look for our other programs in our series, Healthy Children.